Begin with that talk. Professor Vivek Gupta had a request. He wanted to show something interesting. So we can, before the chairpersons and the moderators for the next session comes, I think he can present his talk. Welcome. Try to complete in 5 to 10 minutes. Yeah.
10 minutes, thank you Rahul and Dr. Ankur for giving me this opportunity to talk in the last minute here. Transcatheter aortic valve.
Meanwhile, all the chairpersons, moderators for the next session, I think they can take the dais so that we begin on time.
Can I start now?
Yes.
So, this is a very dear topic for me because I work with Alex Riviere. And first of all, I thank once again the CRISP organizing committee, Dr. Rahul and Dr. Ankur, to give me this opportunity for the first time, for which was a very, very successful conference. I have next 10 minutes with me. Why this talk is so important and so close to my heart, because I work with Alex Riviere, who is the father of TAVI. As we all know, the first in man was done in 2002, April 16. I worked with him in the period of, so I will have shown tribute to Alex Riviere and also bedside to bedside how actually the innovation took place. So I had a wonderful stay with him and I worked with the government of France as a fellow, 1996 to 98. And I had a very special relationship, unfortunately very close. When he wrote the certificate also, one of the most enjoyable relationship he said in his certificate which he gave to me. The few videos I would like to share because he's unfortunately no more. This is the first TAVI from India, November 2011. And TAVI was not allowed not yet approved by TCGI. So we took the patient from India, from Apollo Hospital and then took it. First in man was done, of course we know. This is celebration 2022, but I would like to show you a few memorable videos, especially this one if we can have the sound, because what he spoke on in 9 December 2023 and 2024 he was no more. He never expected
to die. Who is the father of transcatheter aortic valve implantation, which is a surgical technique, and he did the first case in 2002.
Sorry. How can we? No, it's okay. Yeah, that's better. Okay. It was not the slideshow at that time. So what he spoke was, can we have the sound up?
In aortic stenosis patients with degenerative aortic stenosis, and if the valve is not replaced at the onset of the symptoms, the mortality rate is extremely high. So many patients cannot be operated on for surgical valve replacement, and this is why I developed a non-surgical technique, for doing the same, replacing the aortic valve without surgery. And so I started in 2002, and now we have more than 3 million patients implanted in the world, in more than 80 countries. So it's a very big success, which was absolutely unpredictable. So today, in a single year like 2022, we had 200,000 patients implanted in the same year in the world. And so just to give you an idea of the development of this technology, which allowed to replace the aortic valve under local anesthesia, with very short hospitalization, the patients are able to be discharged after the operation just 2 days later. And so it's very successful, and so I was very happy to be invited in Calcutta, for the CSI meeting, where I presented the history of development of this technology, and people were really very much interested, and they welcomed me with a lot of enthusiasm. So this is where we are today, and the future is bright, with the development of the technology again, advanced technology.
So this was I never expected that after somebody
nominated and
because in February 2024 he had a sudden cardiac death, and his injection first was not so bad, and it was something. So this was one of the videos which I wanted to show you when he was working. He was one of the best angioplaster I ever seen. People thought he was only structure. No, he did FFR, he did everything, complex left vein, osteo left vein, distal bifurcation, even 96, 97, 98. So he was one of the best interventional cardiologists as such, doing transseptal like these. So coming to the few videos more, this was when he came to my house in 2015, and it was one of the fantastic video, and he was in a very humorous mood. And this is So I want to share this video because he is unfortunately no more, and he said he scored and he did something very humorous. One of the most humorous guy I've ever seen in my life, and nobody, in fact, in the whole world, this is just a symbolic he is doing. So this was, he was one of the best person I have ever come across, working in Rouen. Then he was driving a car in Rouen when I was there in 2022. Then putting a tap on my, this was during the TAVI celebration, and he was wanting me to speak something, and I said, okay, we'll speak. And then the way he used to have a lot of affection for me, I've just told only 3 minutes left, okay, sorry. So I have to really rush. These are few slides which I wanted to do. So coming on to the developing TAVI road littered with pitfalls. Lessons learned from the experience of the future innovation. Having an idea is not enough. Translating it into reality requires a combination of elements, proving that your idea is good, mental strength capable of overcoming criticism, finding the right partner of the finances to advance, rigorous scientific research, respecting the process of optimal research. Failure of any of these can lead to failure of entire project. This is never give up.